Welcome, everybody.
Hello.
Just want to say thanks again for everybody for taking part in the homework. I know that wasn't easy. You want to recognize that that wasn't a simple exercise. And Robin and I both felt like we might have been a little further, and that exercise might have made a little bit more sense had we gotten to some more discussion around goals. But I hope it was worthwhile in getting everybody to think about prioritization of the list.
Trina, do you mind if I jump in really quickly and just allow the
yes,
interpreter
sorry.
to make the announcement? Yeah, no problem at all.
So, and then there is the.
Sorry, one moment. Kelly, are you able to make the announcement?
Sure, yeah, I was wondering if you needed me to interpret yet or just make the announcement. Para los que están aquí en esta llamada, quienes ocupan interpretación al español, estamos proveyéndole ese servicio. Solamente marque en el globito al fondo de su pantalla o el teléfono, marque en el globito que quiere escuchar en español. Y los que necesitan en español, entonces van a estar en el canal de español. Muchas gracias. And now I will let you, Joanna, put me into the room.
Great. And I'll just add for everyone else, please select, if you're going to listen in the English channel, just select in the bottom right side of your screen. There is a globe icon that says interpretation, and there you can choose English. All right. Back to you, Katrina. Thank you.
Sorry about that. I was just jumping right in. And that is a reminder that speaking speed is important, since there is somebody interpreting, more than one person interpreting. So, sorry, I need to look at my agenda. And Robin, the agenda said reiteration of the shared vision statement, and I couldn't find our vision statement.
Yeah, I think we had asked Dr. Liz for support with that, and I know she wasn't able to be on the call today.
Got it.
Maybe we'll have to forego that.
Which is fine with me. I think we know where we're going. And my agenda, sorry, Robin, doesn't have who's doing what, so I have to go back to my other agenda.
No worries. I think we just wanted to review the overall agenda today and then introduce John. Trina, do you want me to do that, or do you want to go ahead?
You can. I also have our the results of that little exercise we did last time. Should we do that now or before we do the prioritization? Let's wait.
Okay.
So yeah, if you want to introduce John and.
Yeah, so thanks everybody for your patience while we get through the technicalities of a new Zoom channel that we're learning. We moved from the rebuild Zoom to the county Zoom. And then thank you again to our interpreters. And I think we've got that all set up. So that will be, and just a reminder that we are recording the session. And Johanna, is that something that you've started doing, recording, or? Awesome. To start our meeting today, we've asked a couple people to give us some information. So John Kirby is here to talk about the broadband access. And then we've asked Jen Leos, who is a working group member, to talk about the workforce issues, since that came up in the prioritization process as well. And then we're going to spend most of our time on really reviewing the survey results and the input that you have brought to this meeting. If you'll remember, we asked you to do a deeper dive as your homework, to review the survey, to review your colleagues' comments and information, and bring forward your top 3. And then we hope to walk away from this meeting with a better understanding of what high-level concepts we want to bring forward in terms of a top 5. And then we have some homework for our last meeting. So I'm going to turn it over to you, John. John Kirby is a project manager with Boulder County IT, and he's been working on a proposal with regard to broadband, and he's just going to do a high-level overview of what work he's been engaged in. And John, I will pass it over to you.
Okay, thank you, Robin. I appreciate it. Good afternoon, everyone. Appreciate your time this afternoon to be able to give an overview of the Boulder County Broadband Program. As many of you know, there is a national as well as a state level initiative to deploy broadband under the infrastructure bill to residents across Boulder County. I came on in May of last year, and since that time, I have done quite a bit of work trying to do an initial assessment of the current infrastructure across Boulder County to identify areas that are either unserved, underserved, or are experiencing impacts from the digital divide by a lack of adequate access and affordability to broadband. Most of that research has identified that there is a large disparity on the western side of Boulder County, primarily in rural and remote areas. And then there are some areas on the eastern side of Boulder County that are more impacted by the digital divide itself, some economic challenges and technological challenges as well. So what we have done up to this point, we've made the initial assessment. We understand where there is a need for additional infrastructure in all areas of the county. And we have been working on putting together a report to identify all of those details and the specific facilities, community entities that are impacted by a lack of infrastructure, which will lead us basically to the preparation of a broadband plan at the county level that will be shared with the state of Colorado. The state of Colorado does have a broadband office that is working on this initiative with all counties across the state. And out of that broadband plan, then we will produce an RFP that we will share with construction vendors, suppliers, people that can help us put additional infrastructure in place or increase the availability and affordability to residents of Boulder County. A lot of the costs that are going to be associated with this initiative, since it will be financially expensive, they're going to be subsidized by using grants and funding that are available through multiple federal agencies and through some grant availability through the state of Colorado itself. So we have a fairly comprehensive plan in place. We're still doing some fact finding within the county to identify some of the available infrastructure. But that process is pretty much complete at this point. And we're excited about being able to serve the community better by offering broadband to support things such as telehealth, distance learning, emergency response agencies, those folks that are really suffering right now with the lack of sufficient data speeds to support a lot of the applications that I think we all take for granted now. Coming out of the COVID pandemic, it was very evident to everybody, not just here in Boulder County, but across the country, that, broadband is now considered a utility, just like your electricity, your water, et cetera. So Governor Polis has signed an executive order. He did that on February the 18th of this year. And in that executive order, which is available to the public on the state website, he has mandated that the state of Colorado is going to provide broadband services to 99% of the entire state by the end of 2027. So the Boulder County Broadband Program is aligning with that initiative. And we think that we can be extremely successful in filling a lot of the current gaps and disparities across Boulder County for its residents and the communities to make things a little bit better for everybody.
Thank you, John. Does anybody have any questions? So this will result in a proposal that you'll be bringing to the commissioners for approval. Is that correct, John?
Yes, that's the timeline on that, is probably 30 to 60, maybe 90 days out. There are some gating items related to producing that RFP, primarily some of the broadband mapping that has been produced at the federal and state level is inaccurate. So those entities are working on producing more accurate information, which in turn will allow each county to make the best decision possible from that data on how to use funding and where to use it. Obviously, we don't want to spend money in areas where there may already be infrastructure and it just requires an upgrade to the existing technology that provides internet services. But that is forthcoming, and it should be sometime in this early summer, midsummer is what we're forecasting.
Right. So given that broadband was on our in this working group's domain, I think it's rest assured that this work is being done, and it's not something that we have to do a deeper dive in. Kathy, I see your hand up.
Yeah, thank you. And thank you, John, for that. I've worked in the digital divide field, and I applaud getting digital to the county-wide. I am concerned after talking with my organization and other grassroots advocates that the funding for this is is part of the same pie as the funds to address the broader mental health crisis. It's still not clear to me why that wouldn't be in the economic bucket. And so Robin, I guess my question is, how does this relate to our working group?
Yeah, so the funding is not coming out of our bucket. John's proposal will be using other ARPA dollars as well as other grants, state and federal dollars.
Correct. There are a multitude, of grants and funding programs that are available that we plan on leveraging to subsidize these efforts to deploy the additional infrastructure. We're also relying heavily on public-private partnerships, being the county working with internet service providers, some of the larger companies such as Lumen or CenturyLink, Comcast, Xfinity, Zayo. But a lot of the research that I've done over the past few months has led us to local companies. They are smaller in nature, but we're trying to partner with those entities to leverage them and rely on most of them funding their efforts on the construction side and then subsidizing those efforts by applying for grants and additional state and federal funding to cover the remaining costs. So, we're not looking for a large financial allocation from the county to support these efforts. We've been trying to think outside of the box to make sure that all of the other internal organizations and groups across Boulder County aren't impacted by that need.
Thank you, John. And I'll call your attention to a chat that Kathy put in as an idea for you. And then I'm going to call on Craig and then Katrina.
Hello. Yeah, I was just wondering if in addition to this broadband plan, if assistance for kind of the technology that people use to access it will be included in the plan, such as helping people get access to smartphones and laptops and tablets to make sure that people can, utilize the service. And then also, is it being kind of discussed with an increase of, making broadband a utility by 2027 to increase kind of website accessibility on all kind of state and public sites to kind of audit for screen reader compatibility and a lot of the accessibility standards that aren't really up to standard now?
John, I can answer the first part of the question. The county does have a current digital divide project with the first tranche of ARPA dollars that we will likely be recommending to the board to expand to address your recognition of the needs for products, such as laptops or Chromebooks or cell phones, etc. So that'll be handled outside of John's project. And then John, if you want to answer the latter part of Craig's question, and then we're gonna call on Katrina, and then we're gonna have to move on. So if anyone has additional comments or questions, if you could put them in the chat, and we'll follow up outside of the meeting.
Sure, I'll be glad to. Do you mind repeating the second part of the question? I'm sorry, I was typing a response in the chat.
Oh, no worries. Yeah, it just had to do with kind of stepping up the website accessibility standards for state and federal websites and resources. With broadband being a utility, it is super important to make sure everyone has equal access to the online content. So kind of to make sure that the websites are screen reader compatible and have accessibility built into them. And if
Sure, that's more, I would say a technical question that I would probably have to take back to the state and get some additional information on, how that access is going to be limited, if at all. I would assume that just like any other public website, that anybody could access that from any device, whether it's a mobile phone, an iPad, or a laptop. But I can take that question back to the state. I meet with them on a fairly regular basis, and we're having a discussion with them Monday on some other items. So I'll make sure I bring that up.
Yeah, that'd be great. I just know our community, we had a lot of difficulty with accessing a lot of the resources in the last couple of years with COVID resources due to lack of screen reader compatibility and just different Google forms that people had trouble accessing due to just the way the websites were created. Sure. So yeah.
Everybody uses something different. I understand.
Exactly.
Sometimes it's technologically incompatible. I will let everybody know, just kind of as a closing note, Robin, and then I'll let you kind of take over. We do have content already created. That was part of what I've been doing over the past several months for a broadband page on the county website. It's not into production. We're waiting for approval to do that at some point in very near future. But I do have a specific page for broadband to give updates to the community. It does have some links for things like speed tests, provider information, etc. So that will be coming out in the near future as well.
John, thanks so much for joining us this morning. And again, sure. Any follow-up questions that people have or comments, please put them in the chat and we'll make sure to track those. And we'll circle back to John or the appropriate party and get answers for you. I'm going to turn it over now to Jen Layup to comment on the behavioral health workforce shortage and what mental health partners, as well as some of the other community health centers, have been doing to address these issues. Jen, thanks so much for providing that information for the group.
You bet. So just, I wanted to comment a little. I know workforce shortage has come up across really, nationally, and with behavioral health, it's really hit hard. I think just talking about and understanding some of the whys is important. I think what we're experiencing here, particularly in Boulder County, is around cost of living has certainly come into play. I think, higher paying options and the flexibility in some of those work options for behavioral health, I think has also become more readily available to some of the behavioral health providers. So telehealth companies moving into the market, providing that ability to be, working from home. I think within the pandemic, we had folks that moved, out of state to be closer to home and can do telehealth work from there. And I think a big piece of what we're seeing is the acuity level of folks that we're treating with behavioral health has definitely increased. And I think that work is really hard. And people have made choices to move from the behavioral health field based on that. So, I think a key thing, in terms of the salary, just one thing to point out, and then I'll talk just briefly about some of the solutions that we've implemented that I know others across the state have also implemented. And then also from a state perspective, what we're trying to do to really try to influence workforce and behavioral health. But just one thing to point out, really, there's no plans at this point to have specific increase the provider rate specifically. So, there were temporary increases through ARPA, through ARPA dollars, rate increases that come to the state and Medicaid, or through Medicaid specifically, that's passed down through the RAIs, so the regional accountable entities. And there had been a 2% increase that was put on for this year as proposal. And then last week in legislation, I think that was actually moved out. So things are still in play at the legislative level. So I don't think we'll know. There's other options and other legislation moving through that could support that. But right now, we're not seeing those increases. So that will certainly have an impact. So I think as a behavioral health provider, we're all looking at how we can provide some of that flexibility, knowing that's what's needed. And I think what we're looking at in terms of some of the options is how can we increase loan repayment programs. So many of us are part of loan repayment programs, but how is there a way we can increase the amount that we do for loan repayment? And this is again for retention and recruitment for behavioral health. I think looking at housing and childcare stipends. So what can we do to help support people knowing that the cost of living is a real challenge here in our community. We've also looked at like payment for licensure costs. So, we have licensure renewals, all of those things. Training and competency is a huge piece, knowing that the work that we do is so challenging, and how can we really provide that to our employees so that they feel competent in the work and are able to manage some of the high acuity levels and the needs that we're seeing. And then, of course, also looking at one-time incentive payments, knowing that we need a longer-term sustainability plan for overall salary increases. Bottom line is we need base pay to increase to manage not only cost of living, but have it be an appealing work option for folks and to maintain in the field. At a state level, there's lots that's long, and these are more long-term, really looking at admin burden. A lot of folks, particularly for community mental health centers, and I know many of you know this, there's different requirements and regulation, all for good reason. And what that brings is a lot of admin burden that really isn't necessarily experienced in other behavioral health, private practice. There's just a lot more to it. And so we're working with the state on what some of that admin burden looks like and how we can try to streamline and reduce. Also looking at just licensure changes. Many of you also know that certain licensures can only provide certain services, and that really affects workforce shortage. Particularly licensed clinical social workers, and their ability to provide services with Medicare as a payer, but licensed clinical, professions, so LPCs, not able to. And so how can we try to look at different expanding licensure ability to serve? Billing codes, there's certain billing codes that are limited to certain licensure and certain professions. And then really, how do we get out and look at development of workforce and interest in the field? And a lot of that, we've had conversations with the Colorado Department of Education and looking at high schools and opportunities there and how you influence and try to just get people excited and curious about the field and what opportunities we might have there. And again, a lot of those are longer term. So there's, for sure a crisis in behavioral health providers right now. And so there's a lot of the items we really need to look at short term are around some of those that need to be funded that I had mentioned earlier. Hopefully, Robin, that hit on mostly what you were hoping.
Yeah, thank you. Does anybody have any questions for Jen? We know that the workforce shortage is going to impact all of our ideas and prioritization of projects. So it's likely that we'll have to engage deeper into this dilemma along with you, Jen. It's not an easy nut to crack. Okay, Katrina, do you want to take on the next, as we move into the discussion of the survey results and talk about the survey approach and the review of the survey?
Sure. Again, want to recognize that it was quite a long survey, in that we didn't eliminate anything at the very beginning. So I think that when I aggregate some stuff, it shows a little clearer picture. The charts that I sent you, especially the ranking one that was really long, and I'm going to try and share my screen. I'm going to have to do this differently than I thought. The results were spread very wide. We had a lot of ideas, and we had people on both ends of the spectrum doing a lot of the ranking and choosing. So, and I could kind of see who was doing the responses, and it was interesting to see where those were coming from in terms of their respective ideas. So we do have a little bit of work to do on talking about what we really feel are our priorities as a group in terms of being transformational and easy to do. Will we be able to do them? Those types of questions, and what we want to put forward. This is the screen I want to share. Oh, I can see how to do multiple windows, so that's helpful. So is this large enough? Is that better? I redid the chart a little bit to show where they all were together, and what we were feeling, what floated to the top and what floated to the bottom. And then we have a lot in the middle. And we can look at these, and actually I was going to put this document in the chat. Sorry. Maybe I can't put it in the chat. All right. the ones that showed up at the top. Oh, sorry. There we go. Were the urgent care model, provide expanded facilities, and expand the co-responders for a non-law enforcement driven model. I didn't go through and combine anything, but those were the ones that seemed to be overall coming to the top of the list of priorities. Again, remembering that the numbers, the lower the number, the higher the ranking. And again, you can see that it's a little all over the board, but these were the ones that were more consistent in that respect. And then at the bottom, remove barriers experienced by those who are undocumented. And my only comment on that would maybe be because Boulder County does a fairly good job around some of this, the barriers with their equality programs. So I think that what we may want to do is, again, let me figure out how to share this with people, the actual document with people. We need to think about when you went through it and maybe just do some hand up voting on which is the one, which ones do we want to eliminate, and see if we can't narrow it down that way. Unless somebody, Robin, I'm not sure if you had an idea of whether we should talk about them a little bit, or we discussed them pretty good the last time around.
Yeah, I think we were hoping to invite people who were able to bring forward the top three to discuss in more detail, because that was expressed in the survey as well. Desire to discuss more in detail. Carmen, I see that you have your hand up. Do you have a thought here?
Yes, I do. Thank you. So maybe it's a thought, or maybe it's something that we should be doing. The ones at the bottom, impact of pandemic, isolated families, undocumented, the cultural piece. I'm wondering if those shouldn't be a thread, no matter what your top choices are, because that is part of equity. And there's still a lot of work to be done in regards to not just undocumented family, but language access, cultural competency. So even if you went to the top and you chose, I don't know, Katrina, if you, okay, sorry, urgent care center model. So that equity is in there and it's covering those pieces. Does that make sense?
Absolutely. And I think we all recognized that some of these were concrete projects and some were more sort of principles or themes or population specific. So I think that's a really good comment, Carmen, and we can keep that in mind, that even if they were ranked below, it doesn't mean they wouldn't be included in the implementation of any specific project.
We also can combine some, which might help, which I see in the chat. We can, maybe what we should do is combine a couple where we feel like they may be duplicative and go from there.
Yeah, and that was part of the homework, to ask if you saw those combinations. So Katrina, I think we talked about just inviting people to bring forth their top three to get the discussion going. Does that make sense?
Sure.
So who would like to take a stab at this huge puzzle we're trying to put together? Kathy, go for it.
Yeah, you all know I think about this all the time. So top from the folks I talk to in the community, the co-responder statewide 24/7 is part of that, and also the model that does not, that's not driven by law enforcement. Also, I want to say that the idea that's below on Behavioral Hub, so many of these pieces that are presented as individual pieces would be served by a comprehensive, coordinated Behavioral Hub program. I think that was laid out in that Omni report, and that's what we see. For transformational, I am excited about that urgent care model idea. So those are my three.
Thank you. Ellie?
Can you
Oh,
you
sorry.
say which three again? Sorry.
My three are the expanding co-responders, what below, fairly far below, because I think it sounds so technical, the Behavioral Hub. Where did that go on this list? Somebody help us here.
Navigation issues?
Navigation issues, Fast Track Behavioral Health Hub, and navigation services.
Mhm.
That covers a lot on this list. And then the urgent care model, which also covers a lot on the list.
Did you have your hand up previously? Did you take it back down?
I did. I was just waiting.
Yeah, somebody
Yeah,
go.
mine are actually very similar to Kathy's. I think I wrote a comment that I found this exercise to be incredibly challenging because so many of these things intersect, and found myself wanting to just kind of dive deeper into all of these different ideas. But my top three as well were the co-responders model, the navigation issues, and then urgent care as well. And I think as I was, thinking about this, and I think everyone's kind of alluded to that and commented on it, but I think so many of these pieces fit so nicely into that, like thinking about, and I will say, I think the urgent care model, I'm really curious to dive deeper into that and understand the differences between the mental health partners current crisis center and, can there be, more services expanded for substance use, more services for suicide intervention for both youth and young adults? Can we, make sure that we're simplifying all paperwork issues that and barriers to access? So I think there are so many things that are just integrated into kind of these three different pieces. And yeah, I think it's exciting to think about the potential for all three of these. So,
And once we go through everybody and getting a chance to choose their top three, we can start moving some of these things into places where we think they can be combined. So if we keep going with our top three, I think we'll get somewhere where we need to be.
And I want to remind you that, part of the process is that once we come up with our top 3 to 5, county staff will do that deeper dive and do that work to try to figure out what the what is that would actually be brought back to the commissioners for a specific recommendation. So we don't have to figure out that implementation piece during our group. We'd need probably 3 more months to do that as a group. So just wanted to remind people of that piece of the process.
Craig, if you're ready to go.
Yeah, I was just gonna agree with everyone else where I think we could maybe simplify it a little bit because things such as simplifying the process with the barriers to entering treatment with paperwork and also expanding transportation access, those are two things that should be incorporated to any topic that is picked that involves transportation or paperwork. So I think those shouldn't necessarily be their own category, but just incorporated where there's either paperwork or transportation. Those are areas that need to be addressed for access issues. Because I had difficulty with picking a top three because I was looking at all the options. And for instance, if you were to pick the urgent care model, in addition to that model, I would want that model to include expanded transportation options and removing barriers such as paperwork and those options. So to me, there were just so many areas that incorporated the other ones to be successful models if we're kind of trying to recreate them for.
Yeah, choosing the top three was just to kind of give us a starting point. We can move things into it. So did you want to take a stab at your top three?
Yeah, then the top three that I had was expand transportation access so people can get to services, simplify processes that are barriers to entering treatment, such as paperwork, and then navigation issues.
Great. Next, somebody jump in, top three.
Hi, this is Julie. Can I go?
Yeah.
From Sister Carmen. For sure, one of my top issues is expand the co-responders for non-law enforcement driven model. And I'm wondering if the urgent care model could also be or school-based virtual community space, something that I'm trying to see, like urgent care model sounds good for me, but I don't know if it's going to work for the, what did we say, the population specific needs. So I'm wondering if that could be expanded even. So I'm hesitant to say only the urgent care model.
So the differentiate youth adult crisis and suicide and the include substance abuse disorders or expand services that isn't attached to one physical location.
Yes, more like if the urgent care model and school-based model, because school-based model wouldn't work for everybody, but the urgent care model might not work for everybody either. So kind of like a community care, and I'm not sure how to solve that. So sorry, I'm being all over the place, but
nope, this is not easy. So
no, it is not. So I think the co-responders can be helpful if we expand it to be more culturally competent and less sheriff and police department centered. So I think that's going to be really important. But I'm thinking there should be a location, whether it's the urgent care or school-based, but maybe having several centers so there's no wrong door. Does that make sense?
Yep. Someone else come up with some comments?
This is Carmen. It seems like, and again, as we go through this list, there's some pieces that should be integrated elsewhere. So you've got several votes for expanding co-responders for non-law enforcement driven models. And then right under that, you have recognized role of alternative options. And it seems like those should be working together. So for instance, promotoras, and I know Jorge's on the line, promotoras should be connected and collaborating with this expanded co-responders. We've talked about the workforce shortage and we've talked about alternatives, but we haven't addressed finding what do we need to find culturally competent folks, language, those issues there. And then I'm going to go back because I feel like the whole issue around undocumented families and families that were impacted by COVID, it's going to get lost because we're choosing some models, but not saying, but it has to have this integrated into that. So for me, the co-responders that are non-law enforcement, it has to have these pieces. We need to recognize the role of alternative options. So, sorry, I think it sounds like I'm nitpicking that it should have all these pieces, but maybe the question is, how do we make each one equitable to serve all of our communities, whatever you pick? And how do we think outside of the box within those choices, if that makes sense?
Yeah, if you say that, just how do we say that again?
Well, I think how do we make whatever the choice is equitable to serve all in our community? And how is it culturally relevant to all within our community? That might be a better way to say it. Because I think, we already have in place, we've done a lot of work around cultural brokers. We've got some things in place. We have an opportunity to really kind of expand and build more capacity in that area.
Yeah, so that could be a principle for whatever project end up with. And let's just keep that front of mind. And that fits the vision of this whole process, that we were asked to ensure that equity across every project. So I appreciate you continuing to bring it front of mind, Carmen.
Yeah, I think under all of the priorities we choose, we have to still go through and make sure we're addressing those. But I see kind of where some of these priorities address those within several others. So like alternative options, so. Anyone else want to jump in and comment?
I do, it's Chris. My three are to expand the co-responders model and to really work on that navigational hub for including the general public and not just some of the programs that are trying to be established now for prenatal and postnatal care and the criminal justice system. I want it really to be for the general population so that everybody has a way to navigate. And then on the third, I don't mind the urgent care model that we've all been talking about, but I really think it needs to be a network and not really a center where we go. I think that there needs to be a network for us all to be able to group it from happening in criminal justice to the general public of being able to access services at that urgent care center. Somehow we have to build on what we have, and maybe that would be a way to work with what the mental health partners has set up with the crisis center too. So those are my thoughts.
Chad, sorry, I don't know if you wanted to expand on that.
I didn't hear that, Robin, did you?
I did not.
Ask Jorge if he wants to chat, expand on it today.
Yeah. So I put my three top on the, this is Jorge, on the chat. You know, it's pretty much expand the services, the service access that isn't attached to one physical location. You know, like two more like a home base, also support, knowing that a lot of the families, especially the families that we work with, the undocumented families, are really hesitant to really go into systems, you know, for different reasons, maybe for the undocumented status that they might have, or mixed status. I think the other one is we have to, you know, the navigation issues, you know, try to simplify the process, you know, all those barriers that we have, you know, especially to enter treatment or to receive any kind of support. You know, we talk about it, you know, at the beginning, the first meeting, that we should be kind of considering, you know, limited the intake process, all that kind of stuff. And so simplify, and, you know, for me, that's 3-1, navigation issues and simplify process. Yes. And to me, you know, what Carmen was talking about, you know, to really include the equity and cultural lens, you know, to the top 3 choices that we might choose, you know, to really understand that a lot of the communities that we work with, they're not really, it's not just one standard process for everyone. We have a different culturally, linguistic, and different, you know, medical process that families might be experiencing, or they're not, like I said, familiar with systems that exist already. So really looking everything like Carmen mentioned, you know, with the equity lens, and really providing all these comments to kind of allocate them and consider that not everybody will fit the same standard process. So we need to really look at all the communities that we serve and what are their needs to access, you know, mental health support.
Thanks, Jorge. You know, since folks have talked about the urgent care center, Jen, the question came up, and I don't mean to put you on the spot, around the difference between that model and what the state is currently funding, and what they've funded for our region. Do you mind commenting on that?
Yeah, no, not at all. Yeah, and for our region, if folks remember with the governor's crisis model, there were services that could be bid on. And we in our region were awarded and this is under the crisis contract, which Signal Behavioral Health is the one that holds. So we contract with Signal for our crisis services. And so we have our walk-in crisis center, which is on Valmont, you know, on Airport Road, and that provides walk-in crisis, and we have mobile crisis services available there. And so, and the other piece that we've done is we've created a living room model. So meaning it's more of like a 23-hour opportunity for folks to stay and not necessarily go through a full assessment to do that. So we added that. So we have walk-in crisis, mobile, and living room. And then the additional contract we had as part of those services was a respite option. So those are what we're awarded. That's our contract through Signal. The other, throughout the state, they did it geographically. There's other units that are available, and they're crisis stabilization units. And under that title, there's different options. There's acute treatment units, there's crisis clinic units. And so really the state awarded those, you know, more geographically. So we have some to the north and to the south of us. So that's how it currently works. And just so that for this group knows, because I know we've been talking about substance use too, we made the decision several years ago to move our crisis services in with where withdrawal management is. So we have that continuum within that one building. within that, we have the substance use continuum where we have our medication assistant treatment services, where we do Vivitrol and Suboxone. We have an intensive outpatient program where we do substance use intensive outpatient. And then we have some medical services there too that we provide. We've just increased that. So I think one of the things to know is just that we are looking, our vision is expanding on some of that service delivery. Some of that has already happened on the substance use side. And then we are looking at expanding to provide more psychiatric urgent care, and that's sort of in the works. And so we don't have that, currently in place, but that's something that we're looking to develop. So Robin, I hope that, I don't know if there's, I know you and I, Katrina and I talked a little bit, if there's anything else that you think would be valuable around that continuum to speak to.
Does anybody have any questions?
Yes. Can you tell me what intensive outpatient care is?
Yeah, you bet. So we have on the continuum of care, it's basically based on number of hours per week. And so an intensive outpatient program really is 9 hours and above. And so that could be individual and in addition to group treatment. So really, once you hit intensive, it's the number of hours per week that someone receives in service.
Thank you.
Yeah.
I have a question. How would you say how difficult it is for someone to get into the program?
Into outpatient?
Really, any program, because what you're really saying is like that these services are there, but I'm kind of curious regarding access to those services.
Yeah, I think it can change based on and I'll give my top three. One of my top is workforce. And I think the workforce for us affects access. And that's what we're experiencing now with our crisis services. So we have standard metrics that we have around getting people in within a certain amount of time for assessment, and then for first appointment, second appointment. And so we measure all of that. Our goals are, within 7 days, people are in. In terms of crisis services, that's, immediate in service. So I think it depends, and it doesn't depend. We strive for certain metrics, and where it alters is based on workforce and access. So like more for the ongoing, not for crisis. I think the bigger challenges are for ongoing treatment. That is very highly dependent on workforce and ability to get folks in. I hope that answered that.
Jen, do you want to continue with your top three?
Sure. So my top, I know we talked about this, and Robin, you mentioned in the beginning when we were talking workforce. I just worry that we can create and build, new programs and still not have the capacity to serve it well. So workforce is one of my top. I think the other two, it's really around, and I think it was under, and it was already here. Oh, expanding service access that isn't attached to one physical location. So looking at more community-based services.
It's
so I
1
know there's
o'clock.
2 X's there. Yep. And then also sort of connected to that is how can we partner and expand on and recognizing alternative options. And so I don't know where that one is.
Is it this one?
There it is. Yep. Yep. So I think just how do we, because there are so many services that are already available with, and again, this is for me is connected to workforce, right? Like how do we optimize some of the expertise in the community and expand on what we have, and maybe try to shift or just join in ways to serve the community in terms of some of these areas we've identified as having need or higher need.
And Jen, do you have a specific example of, like in your ideal world, is there a program like that You know, I think about the Boulder Strong Recovery Center that was created after the Table Mesa mass shootings. Is that a concept that you're thinking about?
Yeah, right. And I think there's lots of partners that I think are doing great work. That do we bolster some of that to accomplish versus creating something different, right? Like, I think my fear is, and someone already said this, it's like, I just don't want to fragment the system more when there are other opportunities to pull resourcing together to best serve. So I don't know if I had another specific example, Robin, but I just think there's so many of us doing such great work, and how do we coordinate and collaborate that in a more effective way and efficient way?
Yeah, Kathy just called that out in the chat as well. So thank you for that. I think there are a few working group members that have not weighed in with your top three. We'd like to hear from you.
I can go.
Go ahead, Desiree.
So yeah, so I've actually worked with like Workforce Boulder County and dealing with workforce development. So it's kind of the horse before the cart, or the cart in front of the horse. But workforce shortage is probably my number one, getting people into those positions. And really this whole conversation aligns so much with the social determinants of health, because if people aren't being paid enough to live in the county, that could be an issue. One of my second choice is expand service access that isn't attached to one physical location. In working with the Aging and Disability Resource Center, it's not necessarily a bricks and mortar type of model, but more so like an agency that provides information, referral resources, sometimes case management. And then recognizing the role of alternative options, because in this situation, when people are facing various mental health or behavioral health situations, not one way fits for folks. So if there are other options for folks to tap into, then that should be focused on. And what's great here in Boulder County is that there's so many organizations that have all these great models that are being developed or have already been developed. So, you know, why not tap into some of those partnerships there?
Thanks so much, Desiree. We have working group members who have not had a chance to weigh in. Trying to look through our list.
I can go while you're looking through the list.
Hey, I think that we're working group members, aren't we, Katrina?
Yes. And I have an opinion. My top three were one was the recognize the role of alternative options. And I kind of put this in a cultural lens too. It's or a regional lens. Different geographies even have ways of dealing with their own issues, and I think where we're not able to have some of the more official brick and mortar stuff, brick and mortar options that come with brick and mortar, alternative options would be great. We just need a place for them, and we need to make them a part of what's going on. I do like the expanding the co-responders. I've seen it work well up here and have always been impressed with that. So that's one. And then the community space, yeah, expand the service that isn't attached. Recognizing that there are a lot of issues with covering large geographical area, but there can be a lot of stigma for people going into a place. So we have had the mobile vans up here. And one of the reasons, and when they're parked in the middle of town, it's not just something that people are going to really want to walk into, or we need a place to do them so that it doesn't, so that you're not, it's not so obvious. Anyway, those were kind of mine.
I see Jenna's name on the call. I think, Jenna, are you here or is that Kaylee?
I am here, but I am not the Jenna that you are thinking of. I am Jenna Howerton, and I work for Boulder County. I'm also on the board of Rise Against Suicide, which Jenna Clinchard is the director of. But my top three, I work with youth, and I'm also a social worker, so work with mental health. So the most important ones for me were workforce shortage, expand co-responders for a non-law enforcement driven model, and then respond to the need for suicide specific issues. And I sort of saw the, if you scroll down a little bit, there was one that had, I'm trying to find it, adult and, oh yeah, differentiate youth and adult crisis and suicide response services. I think that just goes hand in hand with the respond to the need for suicide specific crisis services. So I saw those kind of as the same.
Yeah.
And then I do agree with others that I think that all three of those need to be culturally informed, and that just needs to be woven throughout whatever we do. And culturally in terms of race, ethnicity, but also in my line of work for the LGBTQ plus community, namely the trans and non-binary gender expansive folks that access services.
Great, thank you. So the other Jenna was not able to join us today, and Kaylee, her development coordinator, was on the call for a little bit, but she had to drop off at 1. So we'll reach out and get their feedback outside of this meeting.
Did you want to choose 3, Robin, or did you?
Sure, and
feeling like you wanted to weigh in?
I think I'm going to answer the question a little bit differently based on the conversation that we've had so far. For those of you who had time or the opportunity to read through the Omni report, you know, what resonated with me was this hub and spoke model, because when I think of the spokes, much of what we've described could be considered a hub and spoke model, whether we're providing alternative options or alternative spaces or community-based, expanding community-based responses like the promaturas or the cultural brokers or the co-responders sort of fit into that model. So I just wanted to say that piece. Workforce shortage is definitely on top of my mind. And I appreciate that some of that work that is related to the paperwork burden from the provider side as well as the client side is being looked at. So I'm not sure what the local control is or the ability to control that locally. You know, I'd love to figure out some sort of proof of concept where we could pay providers and sort of prove to Medicaid that there's a different way of doing the Medicaid reimbursement, but that might be too pie in the sky. And then I love the you know, let's bring services to the people, and so that's in a couple of different areas around expanding service access. And then, so if I have to pick three from here, it's workforce shortage, span service access, and maybe I've picked four then, corresponders and navigation. So similar to what many other people have articulated, better than I just did.
So
Maybe my Medicaid rehabilitation is the moonshot idea.
that's reaching for the moon.
Sounds like a great plan to me.
Yeah. 3, 4.
Yeah, we need total restructuring of the US healthcare system.
Now that's a moonshot idea.
That's a planet Mars shot, but that's what we really need.
If we were meeting in person, I'd be moving sticky notes around. I guess I could have done sticky notes. Here's a 6.
Working group member has gone. Katrina, this is a little outside of our agenda, but given that we have time and given the great conversation, I don't want to put anyone on the spot, but there are a lot of county staff who are already engaged in researching some of this work through the county's behavioral health strategy. And I wanted to invite the county staff, if as you think about this conversation, if you have any comments or guidance or thoughts as we continue to do our work together as a working group. They will need to, be posed to do the deeper dive, but I didn't know if they had any initial organizing thoughts to support this conversation.
Now, what I thought we would do here then too also is to look at what of the things that didn't get listed fit under things that were listed.
Oh, that's right.
So now and I'm happy to, if people want to keep talking, that's fine too. But provide expanded facilities in places where none exist. Some of these things here at the bottom that didn't get an X may fit somewhere else or should fit under something that we've already done. So does anybody see any things that they think could be put together?
I think what you just said about expand to places where none exist. I feel like that's kind of what we're talking about with co-responders. Will go to countywide, like to the edges of the county and culturally, and parent-specific support to address mental health treatment will be behavioral hub is a place many parents will start. That first phone call. And we already talked about, I'll stop talking, but we talked about including substance use disorders in behavioral health design. Implicit in that, behavioral health is also recognizing needs of neurodivergent and people dealing with other disabilities, and having this be inclusive and not siloed.
Would parent-specific support fit with differentiate youth and adult crisis and suicide, and then the other suicide one that we have?
Yeah, I'm going to say as a parent in the system, it's often pre-suicide. The first crisis in a family is often, noticing the anxiety in your teenager, knowing unstructured thinking in your 20-something who's starting to develop a bipolar or psychotic disorder. And that first call is often, long before what conventionally might be considered a crisis, but in the family, if care is given at that point, I mean, it fits in so many ways, like culturally appropriate, responding to communities. If any one of these services is going to meet our families are so different. Every family has its own needs and structure. And I think family centering is an important piece of all of this.
I think, Kathy, you started by saying it's a navigation issue. And the navigation
Yes.
to culturally relevant, culturally informed, as well as parent focused. That could fit under navigation.
Yes.
Lisa, you had your hand up.
Yeah, I just didn't want to leave you hanging there, Robin, with your question of whether any of us on the county team had anything to add. My name is Lisa Moreno, and I am the Behavioral Health Strategic Planner on the new Behavioral Health Planning team for the county. We're based in Community Services. And I was formerly with the Community Foundation in Boulder County. And as I was looking at this, and I think that Kathy, you started us down a great path here, was sort of separating out the what from the how. That there are things like the culture, like the indigenous and identity-based programs, Jenna's point about LGBTQ community, the inclusiveness as Kathy articulated it, and to make sure that those things are in each of the whats that you decide to do. And I also agree with Robin's perspective that the hub concept can be applied to any of the, let me put it the different way, that any of the three things that I think that have been so far received the most X's can be implemented in a hub way, except for the workforce issue, which is an overarching system concept.
Yeah, I would just add to that. So my name's Marcy Campbell, and I also work with Lisa, but previously worked for Boulder County Public Health, leading system and policy work around mental health as well. And so just thinking about the conversations that I've had with community and partners and some of the recent research that we've been doing, I similarly think the hub model, just hearing folks share about navigation needs and sort of that hub model for all with the spokes really seems to be resonant with a lot of folks that I've been in contact with, and really that need for thinking of things like how could potentially the hub work for folks that might prefer to text or, that type of thing, and really be able to be well supported, thinking of all of those equity oriented needs. Something else that I've heard in terms of some of the alternate treatments and some of the promotores models, et cetera, is that some of those may be what individuals prefer to access rather than some of the more traditional models. And some of those aren't reimbursable services or may not be connected to a diagnosis or something like that. So those may be challenges to fund as well. So just wanting to put that out there. And then of course the workforce piece is huge. So I think that's really just critical for us to think about. And one last thing that came up as folks were sharing, and I think Katrina really spoke to this pretty clearly, is I feel curious about what this work group might want to think about in terms of maybe a thread of stigma addressing stigma as part of this. So as we continue to expand, or there are mobile crisis units, you know, how might stigma be addressed so folks utilize what is being made available in a new way. So just want to put that out there and appreciate being here.
Thank you, Marcy.
Hi, I'm Jim Adamsberger. I don't have a whole lot more to add, except to say that these are all very great ideas and dovetail nicely with things that are either already going on in the county, so that they represent both opportunities for additional investment as well as our ability to leverage some of the work that's currently going on, as well as things that are kind of identified as being long-term needs within the behavioral health system. So the hub, the co-responder work, workforce issues, those are all pretty clearly large needs of the county, which will, again, are to some degree being worked on, but also connect nicely with the ideas that were shared in the meeting today.
Thank you, Jim. Katrina, you're doing a great job of mushing things together.
I'm just gonna go do it. It's hard for me to listen and think at the same time. I was just thinking about the what and the how. If we wanted to label any of these with what and how, so that we have that captured. And if I do any of these in the wrong place, you can holler at me, but I thought there were 2 suicides. There we go. In the conversation around simplifying, was that part of the co-responder or the urgent? What happened to our urgent care model?
Maybe that's part of the hub.
I wasn't sure if it was the hub or the, okay. Fast track behavioral hub.
Why I have my mouth open and my mute off. I saw Isa put about stigma as a big topic. How can we do that in Boulder County? And I want to lift up we put it in there and people haven't responded because I think people don't know what the Longmont Sustaining Action for Mental Health community-based initiative did. And it was rooted in addressing stigma and inability for the entire community to respond to mental health crisis through mental health first aid programs that were adapted to fit well for the Latina community of Longmont, and also working with Boulder and Front Range College to adapt to particular other communities to be served. So mental health first aid is a tool for fighting stigma. And the county had, I think still does, I mean, the pandemic means some of these things get lost, but outreach effort called Let's Talk that was really beautiful. It just didn't get, as widespread as it might have. So I hope that stigma fighting continues to, I mean, it makes such a difference. It breaks my heart that people won't go into a mental health mobile unit. Why is this different than having diabetes? Why is this different than having high blood pressure?
Yeah, thanks for calling those out, Kathy. And I think, you know, what you're saying reminds me that we do want to look at what's been working and how do we thread those pieces, tuck those pieces into these other projects. Stigma could be one of those design principles for every single project. So if you're going to have an urgent care center model, how do you destigmatize it? Any other overarching comments on either the top three, the coordination of efforts that Katrina has been doing, any related topic, just such as stigma that we just inserted? The reminder that no matter what we pick, it has to pass that racial equity lens, and culturally inclusive, informed lens, including LGBTQ.
I think that the comment on differentiating between youth and adult services and to the comment that Marcy just made in the chat too, I think no matter each point here, I think that that is important, that there is that within it, because, you know, whether you're looking at urgent care model, or if you scroll up a little bit, the navigation hub, expanding services not in just one physical location, it's going to look differently for youth, especially if you're wanting youth to access it themselves.
Thanks for that, Jenna. Craig, you have your hand up?
Yeah, this is Craig. I just wanted to add real quick that I think it's important to also look at all of these categories from or through a disability lens to incorporate and acknowledge kind of the different services and how they might need to be individualized for people with disabilities, and not just kind of, I think, as Kathy was saying, silo it off to different disability services, but incorporate that framework into each of the topics to include accessible transportation and accessible infrastructure and effective communication methods, including interpreters, and just have that kind of built in from the ground up, as opposed to having to send people with disabilities to specific departments for care, but acknowledge that there are people with disabilities who need to use all of these resources.
Thank you for that. Absolutely.
So, I mean, we have all the lenses, the disability, the youth, the cultural identity. And the lenses, I'm also assuming mean the how, needs to consider all of these things. My in my how, in thinking about recognizing the role of alternative options, was that what I was thinking? I'm really would love to have, you know, more integrated, so the substance use disorders and suicide response and suicide specific, you know, if they, I feel like, and I may be wrong, that they kind of are one of those things that need to go in each one. Are they a lens? Am I off base here?
You're not off base. I think you're just ahead of the game, because I think that goes into the implementation,
into the how,
into the how. So we don't want to lose sight of it, and I'm glad that you're catching that, Katrina. I'm wondering, in our remaining time, if we move on to our next agenda item. It seems like we have a top five, and I
1, 2, 3, 4, 5.
what we wanted to do for next time we meet is, again, our goal is that these ideas will be brought forth to the county team to support, research and making them more of a, what would be the project that would come forth to the commissioners. For our next meeting time, we were hoping with the top 5 that maybe some of you as homework might want to think more deeply in what still need to be answered to flesh these out into projects. So what are the unanswered questions? What are key ideas? We've started this discussion today, but what are some additional key ideas that you want to make sure we don't leave out as the county staff work on proposals? And then are there related key pieces of information? So for instance, is there more information about urgent care versus crisis stabilization that would be important to bring forward? Or more information about specific culturally informed programs that maybe not everybody knows that you would want to make sure was brought forward. Or more about Longmont's project and how that might inform some of our top 5. So I think you're all champions. That's why you're on this working group. But we didn't know if one of these or 2 of these really resonated with some of you who might want to take that homework on before our next group, to each of your areas. And if there's not sort of natural champions coming forward, we could just assign this homework to everybody, because you've already started that conversation. You've already brought forth really key important points that you want included or considered. So I'll stop there and get your feedback about that next process suggestion.
And should we be focusing on the what, not the how at this point still?
Yeah, it's questions that will inform the how, but we're not expecting you to answer the how.
And I was looking at this, we have 1, 2, 3, 4, 5, 6 that got 3 X's or above.
Can we put the alternative options? Can we tuck that as a design principle along with what you put at the top? Along with cultural trauma-based, trauma identified, if we include that there?
As a lens or a?
Yeah, that each project could have an alternative option potentially, or a service option that is sort of different, accessible in a different way.
Okay.
And I think we talked about transportation. If you don't have transportation for some of these that are place-based, or again, we just have to keep in mind that that's an access issue. How would people like to respond to we want you within your expertise, lived experience, passion, to again make sure that we're tracking what are the questions we still need to answer, what are the key ideas related to the top 5 that you want to make sure we don't lose. And then what are just some key pieces of information that you may have that it would inform the project proposal process. And we would love to have those brought forth at our next working group which we will use to further craft the proposals that then we'll be working on to bring forward to the commissioners.
This is Kathy. Would it be appropriate, I've been connecting with grassroots groups on this, and to check back with the base of impacted families and allies and ask. I know we're keeping these in-house. I haven't shown any documents to anybody, but I would be really interested in getting some feedback and, maybe hearing some stories related to how things haven't gone.
Yeah, I think that's absolutely not only appropriate, but it would be very welcomed. Part of the process was for us to determine if there's additional community engagement that we may want to do. So Kathy, if you would take that on, that would be really terrific.
Robin, one of the ideas of the navigation issues or having a hub to go to, I'm trying to see, are there resources in our shared Google Doc that talks about the hub? Okay, I'm gonna do more homework before I speak, because I'm now questioning if I understand the hub concept, because I want to increase access and lessen paperwork. And when we had the peak system, I know that was something we were supporting people to get into peak. And so if it's going to be an online hub to access services, I can see there being some added barriers for people. So I'm confusing myself, so I'll do my homework.
No worries. It's a brand new program, but there are 3 or 4 papers in there that give you more information about it.
Thank you.
And I think we did touch on a few things that were missing, and I'm guessing because nobody's raising their hand to jump in on any one of these, that if we all, and I'll clean this up just a little bit and send it out to everybody. If we all want to look at it and make sure that we've included everything in the 5 things that we want to include. And if we maybe did that before, a couple days before our next meeting, I could combine it all so that we can see it and then do maybe a little group edit, if that makes sense.
Yeah, that would be great, Katrina, and we can send out an email with a due date for that work along with this document. Kathy, you have your hand up. Is it from before, or is it a new hand?
And then I do just want to check in with everybody. Is this kind of what you expected? Is there something we're missing? What is there something that you'd like to say that we're not asking the right questions for you to say? So, I just do want to have that conversation if anybody is feeling the need to add something around the process or around what we're accomplishing.
No, I want to thank you for all the information. I don't think there's much missing now. I don't want to get this group brainstorming, because that's where I struggle is, trying to come up with the top 3, for instance, when there's so many good ideas. But the Omni report I read before voting, and now I've read that, and it sounds like there were some good mapping instructions, but this chart was easier for me to read, and also when you have check marks if it checks more boxes, I kind of think that helps it rise to the top. I don't know if we can duplicate kind of this and our discussions. I don't know.
Is that,
This
if
was a
you-
table from the Boulder County and State and Federal Plan Behavioral Health Priorities. It was in the Omni report, but it's different than what we're talking about. But I wondered if we had a chart where we
if we have that
had,
format?
yeah, we just had check marks so that we're not losing anything. I kind of like that because then I think we can all dig in deeper where we're like, oh, wait, this actually is leaving out a whole population of people that we hadn't thought about, or it, you know, I don't know.
I will look at it and.
Okay.
and- Yeah.
Well,
Was-
if you know, let me ask staff to take a crack at that.
Okay, thank you.
Thank
Tina,
you.
if that's okay with
Yeah.
you.
I should not volunteer for all this stuff. Yes.
I really appreciated Katrina's question about what's, I don't want to open the door to what's missing because we had to have 40 new ideas, right? But it's more about the process and feedback on the process and what would be helpful for our last meeting. The next meeting is our last meeting together.
Oh, so the 31st is our last meeting?
Mhm.
Okay, that's good to know because you've given us so much. I want to make sure I really do a thorough job of reading everything and come prepared then. Thank you.
Yeah, I see our next meeting just talking about, the 5 things and the 5 whats and maybe a list of hows that need to be kept in mind for all of them, because I'm sure they're going to be similar. And then to a point where we can hand them off.
Mika, you have your
Yeah, I was just gonna ask the group maybe for the final meeting, as the county staff and the rest of us continue this work after these couple of meetings and try to put your ideas into action and create the how. Wondering if there's a mechanism or a way to come back to this group or individuals in this group for additional feedback and check-in points, and to make sure that we're getting it right or as close to right as we can as we do the work. So I don't know if there's like a sign-up sheet, if people want to stay engaged at some level that we could create.
Yeah, that's a great question, Mika. And I think Katrina and I can rope that into the email that we send back out, and people can say if they'd be willing to be our subject matter experts and, continue to be like a focus group.
Works for me.
Should I go?
Oh yeah, go for
Yeah,
it.
for our next meeting, I'm just really impressed at all of you all. I mean, I'm just, big soft hug moment for the whole group. But we have folks here who are representing some of the communities that we're speaking of as the overall themes. And I'd really like to make that implicit commitment to serving marginalized communities explicit, and on our next and invite my fellow, what are we even called, committee members, to go back and in here do some listening in communities and really one by one ask at our next meeting, have we heard anything from the LGBTQI community that this is or isn't what we need? is there anything from the Latina community that requires some tweaking of this plan, and actually to voice those at the next meeting, to make sure that we've not just kind of made some assumptions, that we've got that covered. Does that make sense?
Yeah, thank you for that.
I'm going to also acknowledge I missed mentioning the disability community as well.
Well, and you know, Kathy, both you and Mika are raising such a good issue is what's the community connection to this work ongoing? And our behavioral health strategy work will also have a community engagement resource as well. And we'll likely be asking you about that as that work goes forward. But I know, and Johanna and Amy, I don't want to put you on the spot, but I don't know if there's anything related to the ARPA project that suggests continued community engagement with what happens. I know there's a public hearing with the commissioners around all the work that will come forward from the working groups, but is there anything that you would want to add about the
Sure,
continued
I'll jump in.
engagement?
Hello, everybody. I haven't had the chance to meet you. I'm Amy Chester. I'm the director of Rebuild by Design, and Joanna and I have been working with community leaders in Boulder County since the summer on this project, and we're really excited to see it happening. And I'm really impressed by everybody's ideas. The county has recently hired 2 community outreach specialists. They're both on the line here, or maybe Dr. Liz couldn't come to this one, but Aisa is here, and they are supported through ARPA funding, and they're gonna stay on throughout the life of the project. So while Joanna and I will no longer be with the project after this initial stage is completed, you do have Aisa and Dr. Liz who can work with you. They're always going to be points of contact. We can put their emails in the chat right now, and you can always reach out to them.
Thank you for that.
And I'll just
their emails.
I just want to reiterate Kathy's point about using this time in the next 2 weeks to really check back maybe with your networks in this process. We had envisioned that this would be a good time for people to do a little bit specific outreach to make sure that the goals are still in line with the needs of the people who are most impacted by the pandemic. And if there are, as you're going through this, some gaps or questions that you want to also identify for the county to look into, those are great opportunities to identify where further outreach might be needed.
All right. Katrina, do you want to start with any closing remarks, and then I have a couple.
I'm not sure I have any. I will clean this up and send it out to everybody so you can see all my little chicken scratches. I also will send out, I didn't want to send out one more chart to you guys, but I will send out one that kind of shows where things fell with regards to the meets the goals, is inclusive, or does all those, so that you can kind of see those numbers as we move things around. But I do feel like we have some good themes to go forward with. I think some solid ideas.
Yeah, and I know that people have started to jump off the call, so I think we could end here. And I just want to reiterate my gratitude to you all. This was a lofty project, and I wasn't really sure how we were going to make sense out of all of this. And you guys are all brilliant, and coming together in ways that's really exciting. So I really appreciate your time and commitment, and appreciate your interest in your ongoing commitment and participation. So thank you so much.
Thanks, everyone.
Thank you, Robin and Katrina. You led a great meeting.
Yes, thank you so much.
Yeah, woohoo, yay us. Thank
Yay.
you all.